So welcome to this presentation on knowledge translation, and I will be summarizing the readings that are listed here, and I particularly think that it would be worthwhile you exploring these at your leisure. But the Canadian Institutes of Health Research has a primer on knowledge translation, and it really is a sort of growing field in terms of the science of knowledge translation. So CIHR has defined knowledge translation as a dynamic and iterative process that includes the synthesis, dissemination, exchange, and ethically sound application of knowledge to improve the health of Canadians, provide more effective health services and products, and strengthen the healthcare system. So basically, knowledge is no use if it sits in the academic institution. And so knowledge translation is all about getting it out and applying it so that health can be improved. Why do we need knowledge translation? So the stats show that 1/3 of the patients do not get the treatments that have been proven to be effective. 1/4 of patients get care that is not needed or that is potentially harmful. And up to 3/4 of patients don't get the information that they need for decision making. And up to half of physicians, and I'm sure other healthcare providers, actually don't get the evidence that they need to actually make decisions. So actually coming back to that, it comes back to the so what. If we're doing research and we're generating results and findings, and if we're not actually then getting it out, then we come back to the so what question. So why are we doing this research? So you have to think about knowledge translation right from the beginning in terms of how are these results actually going to have any impact. So the different types of knowledge translation that have been articulated. So one is you wait till the end of the grant. So you've done your study and now you've got the results, and you need to then translate that out. And so that could be through conference presentations and publications, education sessions, tool development. And this actually is traditionally how knowledge translation is done. But really it's really only really good for research where the knowledge is not actually very applicable. It's just interesting findings, but it's actually not going to be that useful. Integrated knowledge translation is actually involving the knowledge users, the people who are going to be using the results when the results come out, in the entire process of the research. So you're actually inviting them to work together to help revise their research questions, develop the methods, collecting the data, interpreting the findings, and disseminating the results. And you can see how passionate I get about talking about this, because this is the type of research I've been engaged with over the last, I've had the privilege of engaging in. It's also known as collaborative research or participatory action research. But if you get to the end of it, the end of grant knowledge translation may still be necessary, because in fact the end users are right involved. They're very involved. They know all about it. But in fact the results really need to still go to the stakeholders and the policymakers and the people who are actually going to make a difference in health policy. So when you're planning for knowledge translation, you really have to identify the gaps, and you have to plan for how to implement your study results in an evidence-based way. And so it may be helpful to actually understand some of the models for translation as you're planning your actual project. So the CIHR has got a knowledge to action model. There's also an Ottawa model of research use, and there's other types of KT models. So just to let you know that there are models that have been written about and promoted, and it's very worth your while to know about these different types of models. So this slide shows the CIHR knowledge to action model that actually is a knowledge to action, and it's a circular, but it also has this funnel in the middle. Okay, so just talking about the knowledge creation funnel in more detail, it represents the process that tailors knowledge to the need of the end users. So it starts off with primary studies, so on a particular question, such as the research project that you'll be embarking on, and then it funnels it down to knowledge synthesis, aggregation and synthesis of existing studies, such as systematic reviews and literature reviews, and then it develops knowledge tools and products that actually provide such as practice guidelines and care pathways. So the other part of the model is the action cycle, and there were a number of different facets of this cycle, and if you remember the model, the arrows were going both ways. And so as you're thinking about your research results and how they're going to be applied, you should be thinking about all of these different aspects of the cycle. And particularly if you can engage either the stakeholders or the end users or the different people that have a stake in this research to actually start thinking about ways that the knowledge can be implemented and applied. So I'm not going to go through these in detail because they're all up here, and I do refer you back to those readings, but it is important to think about it. And I must say, in the work that I've been doing with prison health research, the participatory research, we've engaged the end users in all aspects of the cycle, and it's just interesting to start for us to be thinking about ways to engage the policy makers and the ministries in actually working with them to develop strategies to actually continue this work. And it's something you always have to be mindful of. Otherwise you end up doing research that ends up just staying put in the academic realm and isn't actually then applied where it's most needed. So I really encourage you to think about this, and over the years to come I think knowledge translation will become increasingly important, and the science of knowledge translation will continue to develop. So I encourage you in your research journey to be incorporating these ideas into the work that you do. So thank you very much for listening.